Back now with a GMA health alert. Emergency rooms across the country see a big spike in visits during the holidays, more than 30% higher. According to one care system, and our medical correspondent, Dr. Darien Sutton, is an emergency room physician, and right now he is here to tell us how to avoid those trips to the ER. And first things first, why the spike in people going to the ER around this time of year?
I think it mainly comes down to changing our schedules, and we all know this to be true. You're sleeping differently, you're eating and drinking differently, you're traveling, and then you're often ignoring the symptoms. And this is the conversation that I'm having with patients when I'm saying, why didn't you come in 2 days ago or a week ago? And they go, you know, I had this big event and it was really important, and I didn't think that my health was that important. And again, it's so important to understand you can have a million problems, but when you have a problem with health, you only have one, so you have to pay attention to it. Also, what we're seeing in the emergency room are foodborne illnesses, most commonly from the potlucks, and also dehydration as a complication of that, and complications of alcohol, and then people missing their medications. This time of the year, it gets really confusing with your schedule, and many people might not realize it. They miss those morning doses, and unfortunately, that can increase your risk.
All right, so as much as we love to see you, we also know that folks, they don't exactly like going to the ER, right? But sometimes you got to.
Yeah.
When do you know that it's time?
This is a great question. Specifically, when do you know it's time to go to the emergency room versus urgent care? I often have that question when patients are coming in. They're not sure exactly. The main thing here you have to understand is you can always call. You can call ahead and ask and talk about your symptoms, and they can help guide you. For urgent care, if it's painful but stable, I think urgent care is a great option for minor sprains and strains. If you fall and you have a minor injury and you can still walk on that ankle that hurts, and that's something that urgent care can treat. Obviously, flu-like illnesses, if you feel like your symptoms just need to be checked and you want to make sure, that's where urgent care comes in. But when you feel like your symptoms are worsening, or that pain doesn't stop, or that bleeding doesn't stop, or if you have significant changes like chest pain or shortness of breath, or even palpitations, or if you have neck pain after a fall, those are reasons why you need to go to the emergency room. But again, you can call ahead if you aren't sure.
Okay, so how do we not go to the emergency room? I mean, most importantly, what can you do to avoid that?
Yeah, number one, don't ignore symptoms. We talked about this. Don't let the holidays get in front of your health. You want to make sure to always prioritize that. Also, keep your routine. And in this time of changing schedules, write things down so that you can understand what you need to do. And then know your options. Specifically during the holidays, a lot of things are closing down, so you want to call ahead, understand what pharmacies are going to be open, know that your prescriptions can often be transferred to another pharmacy without the involvement of a doctor. That's a common question I get from patients that come in.
Okay, we've got to go, but you said you can call ahead. You're not calling 911. Who do you call?
Not calling 911. You can call the hospital that you're thinking about going to. You can even call the urgent care center, and oftentimes you'll speak to a triage nurse or a charge nurse, and they can help guide you on which way to go.
All right, awesome. Dr. Darien, thank you so much. You always make us better, smarter, and healthier. We wish you a happy and healthy new year.